Hey everybody, I am here interviewing this lovely young lady here whose name will not be referenced, and this is her personal opinion, has nothing to do with any employers. PSA. So, Miss Tess.
Yes.
I'm going to ask you a bunch of questions.
Okay.
And we're just going to kind of chit-chat. Okay. So, we'll start off officially. What is your title and position?
I am an administrator of a home care agency, and I'm an RN as well.
All right. As a home health care, what type of patients do your staff work with in terms of like their types of illnesses and the severity of those illnesses?
So we're a full service agency. We take care of patients anywhere from pediatric to geriatric, anything from immunocompromised to infection control. We service all different diseases and disorders.
Okay. Now, these are going to be the big ones here. What guidance have you received from your company, who will not be named, the state and federal levels, in terms of changing your normal procedures as they affect and direct with the COVID-19 pandemic?
So I don't want to speak for my agency, but I'm sure, like every other agency out there, we are all following the recommendations that the CDC has put forth in ISDH for prevention control. However, I would like to address the fact that, the CDC and ISDH...
ISDH is the Indiana State Department of Health.
Yes. Has not really addressed the real issues that concern home care. Our nurses and our aides are put out there in the field every day. They see numerous patients daily, and there's not been any real true guidance directed towards home care. PPE, which is
personal protective equipment.
Yes, is still on back order, and that's statewide. That is not, new to us. I'm sure every other agency is being affected by it.
Now, when she talks about PPE, that's gloves, that's masks, that's gowns, your basic nursing equipment that you need when you are dealing with someone who potentially has a respiratory illness.
Correct. So this poses a huge risk for not only my staff, but for the clients that we take care of, just like in any other home care setting.
To the best of your knowledge, have you had any of your staff or patients exposed to COVID-19 yet?
So there is a possibility for any home care agency to have that issue where staff or clients are being exposed to it because of the lack of communication we're getting and the lack of support we're getting. That's a huge risk. So we're putting our staff at risk every day, every time we send them out in the field.
Okay. But as of right now, you don't have any confirmed?
No.
Okay.
No.
Now this one I'm going to change up the question I originally had. What sort of procedures are you currently doing now for your staff, both your staff and your clients, if you suspect potentially that they have COVID-19, or how are you basically deciding yes or no?
So we are pre-screening every client before we go and see them. Home health aides, our skilled staff, our nurses, PT, everyone is making that phone call, asking the questions. Are you running a temp? Are you exhibiting signs or symptoms related to the COVID virus? Or do you have a cough? Fever is the big one, and cough, any respiratory issues. At that point, then myself and my clinical manager are coming to a conclusion on whether that patient, we should hold off or we should see that patient. Again, till we get the correct PPE to care for these patients, I can't risk exposure to my employees as well, and the possibility of spreading it to other clients.
Okay, and that actually answered the next question I was going to have, is if your staff suspected, whatever the client's answers were, what would be the next step, and would contact you guys as the supervisors, and then you guys will make the ultimate call on that.
At that point, we're contacting their physician, getting recommendations from their physician. If we think it's a severe enough case, we're contacting ISDH, CDC, trying to get recommendations from them. So far, we have made a few phone calls, and we've not heard any response back.
which is something that is very common right now.
Right.
In general, what is the post-exposure plan for both clients and staff that you're working with?
Well, again, our hands are tied. We are at the mercy of the CDC's recommendations. And right now, their recommendation is notifying the physician if symptoms are severe. There's possible testing done. Our history with it so far has been they're not actually testing. They're telling people to go home and self-quarantine, which is not acceptable at all, especially in our field. It puts us at a very high risk of transmitting this to other patients, the community.
Now, with in terms of staff, are you going to be directing staff to self-quarantine?
Yes.
Also, okay, cool.
We direct them to self-quarantine and notify their physician. LabCorp, of course, is doing testing if orders are obtained from their physician. So the hospitals are refusing to do testing on these employees at this point, but LabCorp will with a physician order.
Okay, and now this is going to be the meat and potatoes of the question that you really want to answer is, what sort of resources do you think the state and the federal government should be providing to home health agencies in particular during this pandemic? What more than what you already have, I guess?
My personal opinion is that home care is right in the middle of all this. When the patients are not sick enough to be seen in the hospital, when there's not enough room in the hospital, they're going to be sent home. So home care is going to be on that front line, being the ones taking care of these patients. And I feel like home care has not been taken as a serious healthcare provider, and it's been that way for years now. You know, we're very educated on disease process and management. We've had to do that to keep up with the demand that hospitals are putting on us and the type of patients we are seeing in the home now. So I feel like we should be the ones that are getting that testing done first. We should be the ones, if we think there's an employee that has been exposed, we're there getting tested right away, so we limit the amount of exposure we're doing to other patients. I feel like we should have all of the PPE gear readily available because we're going to be the ones that are actually out seeing these patients, and we just don't have that. And I don't know if the government is ever going to step in and recognize us as a serious healthcare provider. We follow state and federal mandates just like every other facility and healthcare system.
Right.
So
Now, and then this is a real big question, is there a scenario, given the current pandemic, that you think that home health agencies won't really be able to continue caring for patients?
absolutely. I mean, again, it all goes back to the proper gear. If we don't have proper gear, and we're talking about numerous patients across the state, across the nation that receive home care, and these patients will go without meals. They'll go without someone helping them get their medication. So home care will be severely affected by this because we just can't get the proper gear just to go service these patients. Everything is on back order. I have contacted every supplier that we know and have access to, and everything is on back order. So at this point, and I don't know how other home care agencies are keeping up with it right at this moment, but if someone is infected, we can't service them at this point. And so until someone steps up and says, you know what, home care is going to be the ones that are handling this pandemic, we are just stuck with our hands tied.
Understandable. Anything else that you think people in general should know about this? Any recommendations based upon your nursing experience and skills that you suggest to people?
I suggest that people take it very serious. It shouldn't create panic and fear. It's just like any other thing that happens in this world. We've got to be smart, use common sense. If you're sick, stay home. Don't go buy 40 rolls of toilet paper. You know, because there's other people that still need toilet paper. It's a friend of mine went to get cough medicine for her daughter, and there was no cough medicine left, and she just had a common cold. I mean, it's created mass panic, and there's really no sense in that. We just got to be smart.
Right.
You know, Trump announced that the oil reserves were completely full to the top. Yet yesterday, people were lined up at the gas station filling up their tanks and filling up extra tanks of gas because of the price of gas going down so far. And all that does is create a huge problem for our stock market. I understand it's cheap, but it's cheap for a reason, so we can all get through this and work together. So I'm hoping that everybody that sees this will, reach out to friends and family to just be smart about what you're doing. There are services available if you don't have food in your home. If you need help with getting your medication, there are things being put in place that people will deliver these things to your home at no cost. So there are resources available if you get quarantined. So just be smart.
Great. And wash your hands.
And wash your hands.
All right. Thank you very much, ma'am. I appreciate your time. And thank everybody for watching. And I will talk to you guys later.